21 years ago, I was diagnosed with breast cancer, and at that time, I needed a lumpectomy surgery and radiation. I was fine with it for 21 years when the cancer returned. I had a routine mammogram done and found that I had cancer again. It would require, I was told, chemo. Just hearing the word chemo brought me to tears. I didn't want to be bald because I was worried that my grandchildren, seeing me that way, would be afraid of me.
Well, it was difficult for me understanding that she had cancer and that it reoccurred. There's all these unknowns that you have, which really kind of wears on you. You had all these questions, and you really didn't know how to get the answer to those. I don't want to go to the internet because how many answers do you want of the same question? The first meeting that we had with Dr. Rudnapatna, and he explained the protocol, and he answered all of our questions.
When I met Marissa for the first time in the clinic, certainly she was shell-shocked, anxious about her diagnosis, her prognosis, as well as the concerns of what treatments would do to her. And I sensed that fear in her, the anxiety in her, and I felt she's somebody who would really be served best by the indicative approach of a cancer center, as well as the services the Bliss Cancer Resource Center provides with the navigation. Even if she chose to go to a tertiary center, we still follow up with her and complete the loop for her services. And that was the reason I walked her down to the Cancer Resource Center, so she feels at ease.
And he says, you will be in good hands with these people.
And we were.
Yes, we were.
I think it's a pretty special situation where we are large enough of a facility and program to be able to provide, some cutting edge, really evidence-based treatments and technology, while still being small enough to have personal relationships with patients and to get to know them in that way, and to really support them in individual ways.
And it was a big relief to me, primarily because it became very apparent to me that this was the place where all of our questions could be answered. And the services that they provide would basically carry us through this ordeal.
Then my oncologist shared with me that there was such a device called scalp cooling that could actually save my hair.
Putting on the scalp cooling is a two-man operation. In fact, Dana was there every time, and sometimes she was involved as well. So most of the time it was 4.5 to 5 hours that you're in treatment in order to get the proper treatment from the scalp cooling. I guess as she sat there, you just have to pray that this was going to work.
And it was cold. And I would bundle up in a feather blanket that we would bring from home and mittens. I did lose some hair. I would say I lost probably 45%. I have thick hair, so it didn't show very well. It didn't show up like I was if I had thin hair, but it was worth saving my hair and having that part of my identity.
That is a fantastic service for our patient population in central Iowa that enables women to go through this fairly intensive chemotherapy regimen, but still able to maintain their dignity and their pride. And I think that is fantastic for our community.
We've been able to help and walk through the treatment process with Marissa, with helping with scalp cooling, but then also education and just that emotional support, meeting with her pretty much every time she's come for treatment to be able to just check in and see if there are other supportive things that we can do to help make the treatment path smoother.
We're so grateful for that Cancer Resource Center and everything that it does for people. It really does enhance the patient experience as they go through this. And Marisa and I know that a lot of their funding comes from community support. And we're so compelled to make sure that they are adequately funded in the future that we plan to donate to the Cancer Resource Center to make sure that other people who need that service, it will always be there.
People don't want to talk to you about your cancer, and that really hurts inside to the cancer patient, because to me, that means they don't care. That's how I interpret it. So I would always bring it up, and I would always share with them. And then if they had questions, then we would have a conversation. But I think sharing your story helps others to deal with what maybe they are dealing with.